Hi, my name is Matthew McRae, and I'm posting a short video here today discussing breast reduction. And one of the big things that a lot of people have questions about is whether their breast reduction may be covered by OHIP. I'm a plastic surgeon in Ontario, and our government does provide some subsidy for breast reduction surgery. So how do you qualify? So when you come for a consultation, we will do a number of things. First, we'll discuss what your symptoms are. So the breast reduction surgery is only covered in the setting where you have significant symptoms that could be improved by surgery. So some significant associated symptoms might be pain in the neck, pain in the shoulders, pain in the back. Do you have associated tension headaches due to your kind of shoulders being pulled forward and the upper back being pulled on? Do you have any skin changes, any rashes that happen due to issues with self-care? Are you having some physical activity limitations as a result of the size of your breasts? All those symptoms we would include in our application to the government to ensure that you can have some coverage for the surgery. Another aspect is they expect us to do actual measurements, and that is just to ascertain the current breast size of the patient. Certainly if someone has a very small breast, then the ability to be covered for a breast reduction is limited. So we would have certain measurements, one being just your current bra size. Also, we measure the distance from the sternal notch to the nipple position on both sides, as well as the distance from the nipple itself to the inframammary fold bilaterally. And that gives, I think, the evaluators from the government also an idea of where the breast is currently in terms of size, and then what can be expected in terms of change with surgery. A final criteria that the government uses is called gross disproportion. So breast size relative to body size. And that, I think, is another kind of indicator on what kind of functional impediments you may be having due to significantly large breast size. I will say that there's, for people with breasts that they're happy with the size, but they just want either a restoration or enhancement of the shape, there's a different type of surgery, and that's called mastopexy surgery. There are ways to incorporate aspects of mastopexy surgery into a breast reduction surgery, but generally there are some costs associated with that. We could certainly discuss that with you in clinic. The main issue, of course, being that of liposuction, which is not a government insured benefit. Hope this is helpful. Take care.